We know from so many studies that have been done that popular media plays a huge role in shaping the public's understanding of health. The goal of the paper was really to be a paper that's accessible to the public. It is a paper that anyone can read without a medical background, kind of understand the point, which is women and men both are affected by heart disease. Racial ethnic minorities are disproportionately affected by heart disease.
You're listening to Parallax from Radcliffe Cardiology in association with makeadent.org. Here is your host, Ankur Kalra, MD.
Hello, everyone. Welcome to another episode of Parallax. This is an interesting episode. I've been wanting to do this with Kristen and Dr. Kevin Harris, who are both at Minneapolis Heart Institute. I should actually introduce Kristen as Dr. Kristen Shaw, so I apologize, Kristen, for just calling you Kristen. I just have that mentor relationship with Dr. Harris, so the only way I can think of him and address him is Dr. Harris. So Dr. Shaw and Dr. Harris are both at the Minneapolis Heart Institute. It is my alma mater. It is where I trained, and I graduated in 2015. So it's actually been a decade since I graduated from that program, and owe a lot to that place. And have shared a great relationship with Dr. Harris all these years. So Dr. Harris has this knack of doing pretty innovative papers with fellows. It's sort of the questions that he thinks and maybe the interest that he ignites for clinical investigation in our fellowship program, that we keep coming out with innovative papers, and that just happened to be the case with a paper that Dr. Shaw wrote, Kristen wrote, and was recently published. It was presented, and correct me if I'm wrong, this was presented at the American Heart Association annual scientific sessions as a poster, and then the paper was published subsequently in Journal of the American Heart Association. And it's how acute myocardial infarction gets depicted in the movies. I mean, it's such a fascinating topic and of such important public health relevance, particularly in the current scenario where I think physicians and healthcare providers and allied healthcare professionals and healthcare in general is struggling to get the science across to our beneficiaries, our patients. And I think there is a lot of mistrust/distrust, unfortunately, in messaging. And so this topic, in my mind and in my opinion, is extremely crucial. So with that introduction, Kristen and Dr. Harris, welcome on the show. And thank you so much for doing this for us. Welcome to Parallax.
Well, yeah, thanks very much, Ankur, for inviting us. And congratulations to you on your amazing career as a graduate of our program and your recent new role that you'll be assuming this summer, I believe. But I do want to say one thing is I cannot take credit for this idea. This was Kirsten's idea. I can remember vividly. We're sitting in the Echo Lab. I think she was on our treadmill, and she's like, "Hey guys, I have an idea." And it was her idea. I was there to help support her, and as were some of my colleagues. But it was Kirsten. Maybe you can tell us a little bit about how you came up with it.
It's kind of fun. It's definitely an out-of-the-box idea. It's not the paper you usually see, I think, when you're perusing your cardiovascular disease medical literature. But I give credit to Betty White, because I was a fellow or a resident that had recently matched a cardiology fellowship, and I watched the movie The Proposal. I don't know if you've seen it, but it's Betty White and Sandra Bullock. And there's a scene where Betty White's character has a heart attack. And I remember thinking in that moment, having also just listened to a woman's heart health lecture that referenced that the majority of women don't know the leading cause of death of women is heart disease. And I watched Betty White's character have a heart attack, and she did the whole thing. She clutched her chest, and I think they laid her down and airlifted her away. And I remember thinking, wow, I think that's the first time I've ever seen a woman in film have a heart attack. I can think of The Godfather and Meet Joe Black, and there are all these movies where I could remember men having heart attacks in film, but I think that's the first time I've seen a woman. And then if you know the movie I'm referring to, The Proposal, Betty White's character actually was not having a heart attack. It was this really elaborate mastermind scheme to like get her family back together. So, but that was the inspiration for the paper. And I told Dr. Harris that idea. I tell him any idea I have to make sure it's good or bad. And he was very interested, and we kept it going, and it resulted in this cool paper. So it was a fun project.
Kudos to you, and thanks for thinking of such an innovative idea. I think it's relevant. I mean, I think I've always been fascinated with the intersection of public health and cardiovascular disease, and I think it's becoming even more relevant as we are entering the prevention realm. And I think not a better person than Dr. Harris to run ideas, because he's had this. I mean, if you look at his career, he's had this just amazing track record of publishing incredible papers, unpack papers in great journals, and which are methodologically very sound. I think that's one thing that I learned from him when I was training in our program. So, Kristen, well, congratulations, and thank you for the effort in putting this together, presenting it at AHA, then publishing it. Why don't you tell us more about how you went about answering the question that popped up, which led to this amazing paper?
Yeah. So, essentially the question was, how does film portray heart attacks? And so we used the International Movie Database and just searched for the keyword heart attack. And then you're able to sort films from most popular to least popular films. So essentially we watched the 100 most popular films that had scenes depicting someone having a heart attack. And then we assessed gender and race and ethnicity, which was information we got from the film plots and scripts that were available. And then we also assessed symptoms at the time of their heart attack. And essentially what we found fit with our hypothesis, because our hypothesis was, I think women are going to be underrepresented. I think people of color are going to be underrepresented, and likely the symptoms will be quite dramatic in film, as they probably should be for a movie to be interesting and captivating to people. But our results were, I think, just quite markedly more significant than we thought. So, for example, out of 100 films, we found that 90 showed a man having a heart attack and only 10 portrayed a woman having a heart attack. And in terms of race and ethnicity, we found that only 6 of the 100 films actually portrayed an individual of color having a heart attack. And then in terms of symptoms, as one would expect, symptoms were very over-dramatized and very dramatic. But the things that really stood out were not only did people have a lot of chest pain and a lot of clutching their chest, but the majority of people actually fell down to the ground at the time of their heart attack. And the majority of people actually lost consciousness at the time of their heart attack. For the woman population, 10 of 10 women, 100% of the women who had heart attacks in film lost consciousness with their heart attack. And oftentimes what that was trying to convey in the film was a cardiac arrest. And just as using the woman group as an example, 100% of women having a cardiac arrest with their heart attack is so much higher than in real life, where we see it's about 4 to 12%, I think, of MIs are complicated by cardiac arrest. So just to kind of highlight how much more dramatic these portrayals in film were than in real life. And we thought it was an important thing to investigate, because in order to know where to educate people and the public and where to put our advocacy and where to, teach our patients the most, it's interesting to see what information they're getting from popular media, because so many of our patients get a lot of their health information from mass media, social media, popular media. So we thought it would be helpful to see kind of what misconceptions are being perpetuated in film, and then we can kind of know where to provide more education in which areas.
Yes, I mean, it's fascinating that you described women having cardiac arrest as the sine qua non representation of acute myocardial infarction in film. I mean, Dr. Harris, when you first looked at these data and what Kristen had put together in terms of the movies that were selected and then the depiction, what came to your mind? I mean, what was the synopsis that you generated after you saw what you saw?
Yeah, so what's interesting, and I think Kirsten is kind of understating the amount of work that that went into this, because she actually started out watching like 170 movies in order to get to the 100 movies that actually were actual legitimate heart attacks. The thing that really struck me, and I've been doing this a long time, so I've seen a lot of people with heart attacks, but were these symptoms of, or these depictions where people are falling, where people were screaming out and clutching their chest. Of course, there's the Levine sign, but this is not the typical. And it's interesting when I talk to non-medical family or friends, and kind of, hey, did you hear about this? And they're like, oh, isn't that the way a heart attack is? I didn't know that you don't fall to the ground with your heart attack. So I was, that was actually eye-opening to me, is that what Kirsten found was actually what people that I've run into really believe a heart attack presents like.
Yeah, I mean, it's profound at so many levels. Like, I mean, I think just first off, to think of an idea like this, that movies are ubiquitous in any culture. I mean, whether it's the U.S. or I mean, any country. You can take Europe or Asia, India. I mean, in India, the Hindi film industry is one of the largest generators of GDP. So movies are ubiquitous, and they are accessible. People watch them. People garner whatever they garner from the movies, and to some extent, they are representation of the societal fabric, and vice versa. So I think, to me, this idea is profound, that to study it systematically and to then discern what is being relayed is crucial public health, sort of public health messaging. So, I mean, again, when I read the abstract and when I saw the paper, I was like, wow, this is such a great idea. Congratulations for putting this together. So, Kirsten, I'm gonna, after we're done with the podcast, your have you share your movie recommendation list with me. But before we do that, what were your what would be your recommendations, or what did you think when you were putting this together as a manuscript? What did you think you would write in the discussion section? And how do you think we can, as a medical community, as cardiologists, how do you think we can impact what is being depicted in cinema, which I know our patients and people at large in populations consume?
Yeah, that's a great question. I think, when I was writing the manuscript discussion, I believe my first discussion was very descriptive of our findings and didn't add much to your point there. And then showing it to Dr. Harris, Dr. Ritu Saxena was the other cardiologist on the paper. And they really helped us format that discussion to make it more impactful and a little bit more meaningful, which I think really is, almost a call to action. That is, we need to continue to raise awareness in these groups, because we know from so many studies that have been done that popular media plays a huge role in shaping the public's understanding of health, and in particular of cardiovascular health. There was a study I think about a decade ago that showed that most individuals got their health information from TV, and magazines was another huge part of that. And then some of the data that comes out now, like 33% of Gen Z trust TikTok more than their doctor, and things like that you see in the headlines now. But so I think the goal of the paper was really to be a paper that's accessible to the public and readable by the public. And, it is a paper that anyone can read without a medical background even, and understand what it's saying and kind of understand the point, which is, by the way, women and men both are affected by heart disease. And by the way, people of color, racial ethnic minorities are, disproportionately affected by heart disease. And by the way, subtle symptoms of heart disease include things like jaw pain, back pain, shortness of breath, mild chest pain or chest tightness or pressure. So I think the paper ended up being sort of an education tool almost more than anything for both providers and patients. And it did garner a fair bit of media attention, which I think was great for the outreach piece of it. I believe it was 37 different news outlets that featured it. And So it was able to go far, and I hope it made, even one impact would be amazing on folks.
Yes, I mean, well, as it should, I mean, I think it should deserve the media attention, and it should absolutely um, be covered by the lay press or popular media, and should reach the people who are making, cinema and making movies, and be like, hey, you whether you think, or I mean, I'm sure they probably know, like the content that they're producing is being watched by millions, and uh, people take home messages from what they see, and visuals are so much more stronger than um, written or spoken word, and it's crucial to depict what is accurate, in a visual format. Um, did you? I'm gonna ask Dr. Harris about this particular question. Did you think you should reach out in particular to some of these maybe production houses or media in California?
Yeah, well, Dr. Shah will be moving, unfortunately, unfortunately for us, I should say, will be moving to California. So she'll be have more potential to connect, and I believe has some connections on some level. As we wrote the paper, we debated like how much to say that the movie should take responsibility, because like if you're making the movie, you want it to be dramatic, right? You can't have these very subtle symptoms. So we definitely understand it, but yet I think there is a call for more realistic depiction, and how that happens, I don't know exactly, but I think a connection with the film industry would be useful. And do you want to speak a little bit about that?
Yeah, there's some nonprofits even out there that I've spoken to. One nonprofit that does free consulting for film to help guide, the accuracy of cardiovascular disease portrayal in film. And so that's definitely a cool avenue, and I think important one to go down with this. And just also acknowledging that it's a creative process, and we're not criticizing necessarily the film industry, but it is something there's room for improvement, like Dr. Harris said.
Yeah, no, I think in all due fairness, it's a creative process, and I think there is some cinematic liberty that comes with making movies, and all of us appreciate that and understand that. Knowing also, though, that I think when it's a depiction of a medical emergency, then it's sort of, whether you like it or not, it becomes a dissemination tool for whoever's seeing. It sort of becomes educational. I mean, inherently, people are interested in health and their own health, and they are going to imbibe what they're going to see on screen, and then it I think is maybe moral social responsibility to depict whatever you are depicting in somewhat of an accurate fashion, so that that maybe 1, 2, 3, 5 minutes are accurately depicted for whoever's seeing, so that you're also disseminating or warning signs that patients, public, should look out for.
Yeah, absolutely. And to that exact point, one of my really strong long-term goals here is to get a similar message at the end of films that show a heart attack, similar to how when there is suicide or self-harm or something shown in a film, they have a message at the end that says, if you or your loved one is struggling with this, here's the suicide hotline, or here. And I don't think it's unreasonable for the leading cause of death of men and women being heart disease to, at the end of these films, build in a message like that. If you are having these symptoms of a true heart attack, a heart attack was shown in this film. This is what true heart attack symptoms are. This is when you call 911. So if you know anyone who would help me with that, I would love to do that.
Well, and then maybe a link to a reputable source that you could get the information.
Absolutely.
From American Heart Association, for example.
Yeah. Yeah. And the other thing, that came up when I looked at the data, and this piece didn't get into our paper because I looked at it after the fact, but like 60% of the people in film died from their heart attack. In the storyline, they died from their heart attack. Compared to in real life, again, it's about 12% of MIs result in death. And so it's just this, again, to speak to the over dramatic, most people are dying from their heart attack in film, much more common than in real life. And that kind of contributes to the misconception that a lot of people think that if you have a heart attack, you just die. And there's been surveys that show this. People don't know there's time to get to the hospital, get treatment. It's so just another message that these really dramatic portrayals kind of continue to perpetuate.
Yes. Was there anything else that you found when you were, watching these films? Anything else that you think struck a chord with you as an investigator, which maybe you thought would be a different project or a separate project?
Yeah, there's two things. One is that there are a lot of horror movies that kill their characters via a heart attack, and I'm curious about that. But on a more serious note, the thing that stood out is when people do have a cardiac arrest, so to speak, in these movies, oftentimes not a lot is done to then help that person, and that's something, including CPR, which is something. And Dr. Harris, you can talk a little bit more about that too.
Yeah. And so it is, under embargo now, but we sort of have the sequel to this paper that we're going to be presenting as a moderated poster at ACC, which is going to look at the way cardiac arrests are depicted, including CPR. And as you may imagine, there's going to be room for improvement in that area as well.
It's I think you're building a fascinating line of work. I think it's again, to me, is at the intersection of public health and cardiovascular disease. And, like we've discussed, so many of us watch movies. And I think, sometimes, particularly as physicians or, as trained professionals, you sort of are watching the movie and you sort of chuckle, is like, what are they showing? But, that's exactly the point. The point is for whatever is shown for however many minutes should be shown. And I've sort of wondered, is like, why aren't these directors like picking up the phone? Like, I'm sure they know some doctors, like, why aren't they just picking up the phone, like, phone a friend and they're like, am I like doing this right?
Well, and you wonder too, like if, I don't watch a lot of television medical shows, but you wonder, I'm sure they have medical advisors. So maybe we didn't look at that, but maybe hopefully that's more accurate. I don't know. We watch more mainstream, film.
Yes, no, I think, well, you would hope that, of course, there's dramatization and there's like a lot of zebras that they get presented. I think the one show that comes to my mind is House. Depicts a lot of zebras all the time. And, that's not how, wards work in real life. Common things are common. But I think maybe, if anyone, maybe Kristen, we have work cut out for you here. Maybe you want to tackle the television shows next to see if what they're showing is truly on point or is, all over the place. I think it would construct for a fascinating heat map.
Yeah, absolutely.
All right. So, where do you see this? Where do you, I think we've discussed some of this, we've discussed in part, but where do you see this work go or move forward in terms of, do you want to delve more into this realm of what I would still call, clinical investigation? It's pretty fascinating to me as a clinical investigator myself. It still is super fascinating to me because, it's, I think the underlying message is so important for our patients.
Every paper now that we've done on this kind of prompts 6 more questions. So and just as we made up another one right now together. So I really enjoy doing this. It's fun research to dive into. And I really like that I can talk about it with my patients. It's very relatable and I've really enjoyed that. So I think definitely a lot more to come in the area.
Yeah, what was this was, I'm curious to know. I know a lot of people at MHI, and what was the response from your colleagues, Dr. Harris, when this was presented at AHA and then, published in JAHA? What was What did everyone have to say?
Well, I think they look at it and say, this is super interesting. Like, how did Kirsten come up with this idea? And what a great idea, and how this kind of serves the mission of educating the public, because that, like she said, I think any of these things that have the crossover where there's going to be the media attention, I think that means that it's easy for the lay public to digest it, and hopefully they take away. Like there was a nice the MHIF wrote a really nice sort of description of this, and as did the American Heart Association. They have a really kind of a nice summary. So hopefully, really what we want is we want our patients to be going to sources like that, where they're going to get these take home points. Heart attack is not as dramatic as it's depicted in the movies. This is happening to women. It's happening to underrepresented groups, and those are the take home points that we want and hope. And I think we probably did achieve to some degree that the public's going to have a little bit better understanding.
Yes, and I think that it's a good segue for me to ask you both, and each of you can respond to this individually. What is your take on the the mistrust or the distrust? And I know there is slight difference in each of these terms, but what do you think has happened? Because I don't when I was training, and I can't believe that it's been a decade already, but when I was training as a fellow a decade ago, I did not maybe see that the extent of mistrust or distrust, at least in the US, when it comes to healthcare, would be how to the extent that I see it now. So maybe I'll start with you, Dr. Harris. What do you think happened? What do you think has eroded maybe in the last decade, or so is my perception, that we see more mistrust or distrust in the healthcare community from our patients? And then Kristen, I'll have you answer it as well.
Yeah, I don't know, and I feel like it got worse during the pandemic, right? I mean, I think the way I look at it, there was always, there's been this movement of like vaccine has, I think we're all believers in the appropriate vaccines here, but there was this kind of underground movement of vaccine hesitancy. And then with the COVID pandemic, I think some of these opposing views were magnified. There was a lot of misinformation. And then all of a sudden, depending where your clinic is, I'm finding that, if a patient asks me my opinion about a vaccine or something, which, was happening as a cardiologist, I would find that, the patients would not agree with me. And, and then that has just gotten worse, I think, over time. I can't really speak to what else. I mean, we've seen this, of course, with people not wanting to take their statins, right? Or here, you see a patient who you think needs a statin, and if you Google statin side effects, you're going to find, all kinds of things out there that are, not maybe the most common things that you and I see in practice every day, right? The vast majority of our patients are tolerating their statins just fine. But yeah, I don't know. I don't know exactly how we counteract it, apart from getting good, accurate information out there on reputable sources, which would be, American Heart, whatever other reputable organization, Mayo Clinic, Cleveland Clinic have good websites, et cetera.
Yeah, I think social media has a lot of pros and also a lot of cons. And I think one of the cons is that anyone can have 1 million followers and then say something and may or may not be true. And then that just gets accepted as truth. And there's a bit less fact checking sometimes on some of that stuff. And I think that's really creeped into people's health opinions, and that gets really challenging for us as providers.
Yes, and Kirsten, what has your perception been as as a resident in medicine and then as a fellow in training? What has your perception been when you've talked to patients? And I know we have the fellowship gives us a great mix, taking care of patients on either spectrum. I mean, across the spectrum of all walks of life. Between Hennepin County Medical Center and the Minneapolis Heart Institute. What has your perception been as a fellow in training? I'm curious, genuinely curious, now that I've been out from that community for 10 years. I think it would be interesting for me to learn from you.
Yeah, I think, we do have many patients that clearly show their distrust in healthcare and are very open talking about their past negative experiences they've had. And I think my biggest takeaway has been from some of our, as amazing teaching faculty at both sites and faculty has showed me time and time again, the best way to help people is really, keep bringing them back to clinic, baby steps, one thing at a time, and, just gradually build that relationship and build trust and respect with your patients. But it can be so challenging, especially in Minneapolis when our area went through such a tough time, staying connected to our community, I think during like George Floyd times and the pandemic and but I think that it comes down to just continuing to build those relationships and trust with your patients the best you can.
Yes, no, extremely well put there. Thanks for that answer. Any closing remarks I'm going to start with you, Kristen, and then move on to Dr. Harris. Any closing remarks? Anything you think we have not covered about the paper or about your existing work in the space or future work?
No, I'm so excited to meet you and be on your podcast. And thank you so much for giving us time to talk about it. It's been a great experience.
Oh, no, my pleasure. Thank you for doing this for us, honestly.
Yeah, and thanks so much, Ankur. I appreciate all your kind words. And, it's really an honor. I've been listening to many of your podcasts, including the one with Dr. Fooster, I think was my favorite, but I've enjoyed so many of them and such an honor to be on the show with you and be able to talk about this important work that we did.
Yeah, no. Well, look, the sentiment is equally shared. The honor is mine to host you both. I hold the place in very dearly and in deep regard, and still cherish my time. I think I really enjoyed my fellowship at MHI and at Hennepin. It was a productive 3 years for me. It set me up nicely for my subspecialty training. So I owe a lot to the place and owe a lot to the connections that I made when I was training there. So thank you both again for being here, and for our listeners, thank you so much for joining us again. As you know, it's every other Monday. Do share your feedback with us and email us. We're going to share this paper on the show notes. And if you have any questions for Drs. Shaw or Harris, feel free to reach out to them or to us, and we'll forward the emails to them. You can review us on Apple Podcasts, SoundCloud, and Spotify, or any other app that you use to access podcasts. And once again, thank you for listening, and we'll be back other Monday with another guest. Thank you.
We hope you enjoyed today's podcast, produced by Radcliffe Cardiology in association with makeadent.org. We aim to bring you a new angle of all things cardiology every second week. Review us on your favourite podcast app, or send your comments or questions to podcast@radcliffe-group.com. To view the series, head to radcliffecardiology.com/podcasts/Parallax. Thanks for listening.